One of the founder members of AMEE is Professor Andrzej Wojtczak from Poland, and I'm glad that he's able to spend some time now to come and tell us a little bit, Andrzej, about the changes you've seen in the AMEE conference.
Yes, that's right. It is tremendous change because, I remember this first few conferences where the participation was 50, 60 people. Of course, it having a very crowd people is something marvelous, but it's a little bit disadvantage, before you know each other. And there was, besides this formal exchange of view, exchange of experience, you could personally contact all the people, learning about the innovation, about other. Here, having so many people, of course you have much more formal contacts through the symposia or presentation. On the other hand, it's a great success for AMEE that is attracting, being European association is attracting so many people from the other continents. I must say that we had a lot of contacts with Canada and the United States, but rather it was for a long period of time very European, with some kind of attracting participants also from Latin America. Well, just it's a very big, and I think that here I must pinpoint the man who worked for this success. It's Ronald Harden. It's Ronald Harden when he became in 1986 Secretary General. I must say he put a lot of efforts to attract the people from different continents, and because of his name and a lot of traveling, we always said that he's perpetual traveler, educational traveler. This association was growing, and I must say that besides this plenary session, which were rather regular before, now you have variety of the activities, different activities.
And of course, so, if you look at the program, I think there are something like 32 parallel sessions going on.
You cannot compare this workshop before the conference, which are, I think, a very good innovation, because there is a really place where these young people who are coming to this workshop, they are working together, they are exchanging view. This is a really, I would say, very important part of this session, plenary session or other.
I think that's part of the success, isn't it? Because although the conference now is very, very big from its early beginnings, I think there are 3,500 people here this time, but the fact that they divide into small groups of special interests makes the program digestible, and people who have a special interest share with others.
It's true, because the number of people who are interested in medical education is growing, and in all countries. And before when we started, medical education was not discipline. It was not specialty. It was something what was mostly interest of different persons, mostly clinician, not medical educators. Just now you have specialty of medical educator. So it's completely different. It's just now it's very professional, and even in this medical education you have different subspecialties. And no wonder that people are trying to find out what is interesting for them.
And I think it's becoming more recognized as a requirement to be a faculty teacher, that you should have some qualification. And if you're thinking of a career in medical education, there are plenty of things now to attract your attention.
That's right. It was not usual to have medical educators, advisors of clinical teachers. It was thought that if you are a good clinician, you can teach. Now we know that it is especially you need special methodology approach and all. So everything changed. I must say that especially during this meeting, very good selection of the presenter during this plenary session. They were exciting yesterday presentation, and also today about this resilience, which is extremely important topic.
And these new topics which we weren't aware of even 3 or 4 years ago have now become very important. And
that's right.
And as you say, we had another angle on resilience and its management today.
Yes, and it's really congratulations that such topic has taken as a really leading theme for discussion after that discussion.
Yeah.
I think that these conferences just now are very well known over the world, and people are coming here to learn what are modern trends in medical education, where we are going with this medical education. And here I must say that the Secretariat of the AMEE, President, Secretary General, but also the member of Executive Committee are playing the role of guides, indicating the new horizons in medical education.
And of course, you are the convener or the chairman of the nominations committee for the exec.
Yes, that's right. And for years, we are trying to find out among the persons who are nominated for executive committees the best with qualification, variety of qualification, good geographical distribution, so that they can bring to the association, to the work of association, the different views and of course different competences and possibilities of working and pushing forward.